Before we get started with this podcast, we want to let you know that we are covering a very sensitive and tough topic in this podcast. And for that reason, we're going to be using some vocabulary and language that we don't typically use, that you may not be accustomed to hearing on the podcast.
Right. Yeah, we're always a little bit concerned about the topics that we choose, but we really felt that it was time to address this one. And we're going to try to be judicious and cautious, but I think it's fair to warn that it might not be appropriate for all age groups. Certainly it is for adults and I would guess teenagers.
Yeah, definitely. But we'll let you make that decision. Just be aware that it may be something that you want to listen to when there's not so many ears in the car or in the room while you're checking it out.
Yeah,
so,
you may want to listen to it first and then do a family group.
Absolutely. So, but we hope that you enjoy it and learn some and reach out to us if you have any questions. So, all right, here's the podcast. Welcome back. Richard, today we're going to attempt to tackle a pretty challenging and a somewhat controversial and topic that is really difficult, I think, for a lot of people to talk about and to think about. And so we're gonna start our conversation today because of some recent legislation that's come out of different states and just a lot of issues that we know as it relates to this topic. And so we're gonna begin a discussion today about transgender youth.
Right. It's a topic we want to discuss because more and more parents are bringing this to us to ask our advice as to how to handle this very, very difficult issue. It's a problem for kids. It's a problem for parents. Parents in particular are really struggling to thread this needle because they want to support their children, but they know the dangers and the problems that kids might encounter by this very difficult decision. So they're struggling to find a place between their own personal beliefs on the topic of sex and gender, but still be supportive of their children who seem to be struggling with the issue. So we're encountering it more and more in our practice. Parents are struggling, we know that. And the problem is, at least from our point of view, as a psychologist and as somebody whose advice is being sought by parents, is that legislation now is being passed that could impose penalties on some of the decisions that might be made. And so again, it's like legislation is getting ahead of what we know about this very difficult topic.
Right, and those penalties, that legislation is looking to assign penalties to the kids, the parents, even medical professionals who are trying to help these families. So, yeah, it's a very interesting and unfortunately not completely surprising move that we're seeing, because it happens with a lot of things where it seems as though legislation is moving ahead of the wave. And I think some people will see that as a positive thing. They're ahead of the curve and they're trying to prevent problems or whatever. But at the same time, when it comes to things like this, we're not really waiting for science. We're not really waiting for us to really know things. We're just working in basing things upon beliefs and basing things on different perspectives that may not be common among everyone.
Right.
And so, yeah, we have to be careful about that.
Yeah, when we start passing laws, and imposing penalties, these promise to impose penalties, as you said, on children, on parents, on medical providers, and in some states on teachers who will find themselves in legal trouble if they violate these laws. And yet the laws are based on information or what we now call facts, and we have to be very careful with the word facts, because again, it's whose facts are we talking about? And my goodness, we spent enough years debating that topic. So who gets to decide? And I think that's the important issue. And when should that decision be made?
Right.
And we begin with a caveat. I don't pretend to have the answer to this, to the issue of transgender youth. I
Right.
don't for a moment, and nowhere in here are we going to say, therefore, this is how you should handle this problem. We don't pretend for a moment
Right.
to understand this issue completely, okay? We know that there are very strong feelings and opinions about the issue,
On
but
both
it
sides.
seems like, I'm sorry, on
On
both sides. That's right. There are people who absolutely say, this is how it is, and they're absolutely on the other side. On the other end of the spectrum are people who say, no, I completely disagree. But I think we have an obligation to try, at least try to respect everybody's opinion.
Right.
I mean, again, we don't have demonstrable facts that we can say, this is exactly how it is. And whenever we don't have that kind of hard data, then we need to respect everybody's point of view on a topic, especially when we're talking about punishing one group.
Right.
I mean that's where we get into problems. We
Absolutely.
also acknowledge that there are very difficult practical dilemmas that are created
Right.
by transgender individuals. The use of restrooms, for example, and we saw it happen in North Carolina a few years ago, where they passed a law that said you can only use the restroom based on your physical appearance or what you were supposedly born as. And then I guess the National Basketball Association or the NCAA removed their tournament from North Carolina. The law was repealed. Doesn't solve the problem. We
Right.
still have to decide. Another problem that's coming up is if a person is a male, born a male, and then becomes transgender, can they participate in women's athletics?
Right.
Because they would have an obvious physical advantage. Okay. Third, what about names? Frequently, young teenagers will come in and say, "I want my parents to call me by my other name."
Right.
And parents struggle with that. And then the whole issue of pronouns. Do I refer to him as him or her or they? So there are lots of practical implications here that we also have to resolve. So it's a very difficult, very complex problem that's going to probably require a lot of understanding, a lot of patience to get to some resolution that satisfies everybody.
Absolutely. And I think in response to that too, I think that we have to say that there's not going to, I'm sure that there will not be a solution that's going to be acceptable by everyone.
Right.
This is the case with so many other things.
Mhm.
But as we're having this discussion, we're going to do our best to be as respectful in everything to everyone as possible,
Right.
because it's really difficult when talking about some of these things to be cognizant of everything. So, like for example, a minute ago you mentioned that about athletics based upon the gender you were born with or the sex that you were born with. Well, that's what you were assigned at birth.
Mhm.
And so I know that to be completely observant of everybody's perspective, you would say the gender you were assigned at birth, not the gender you were born with. But there's a lot of those nuances, and so we are going to work really hard to be mindful of that as we're having this discussion, and because it is such a um,
Right.
complicated topic, and I think just to be aware that there are so many nuances with the way in which vocabulary is used when we're having this discussion. Like you said, with pronouns, it's so specific and so detail oriented, and so we are going to work really hard to be respectful and all as we're having this discussion. So just be aware as we're having
Right.
this
Right.
discussion.
It's a very delicate topic. I mean, it's hard to get exactly the right word out so that you don't offend anybody.
Absolutely.
But so I see the problem The crux of this problem, I believe, and I say I believe,
Mhm.
notice I didn't say I know, my humble opinion, we're imposing a binary solution on a non-binary problem.
Right.
But binary, this word binary means you either are this or that. By, the term by is two. It's either this or it's this. So you're either a male or a female. So when you say you were born this or this, that's binary. You're saying there are only two. What we know now, what we've learned over the past 50 years, is that sex, even biological sex, is not either or.
Right.
You are on a spectrum. There's something called, scientists use the term intersex, which means that biologically, you can have the genitalia, you can have the physical appearance of a male, but yet your chromosomes are those of a female,
Right.
or your hormones are those of a female. So it's not a simple binary solution. And so the solution has to accommodate more than just either or. And I think that's the problem we're struggling with. So the basis of the argument that you're born either male or female, but that's based on appearance. We know that, for example, XX and XY, you all heard of that. And even in high school, you started to talk about that if you're XY, you're a male. But there are women who have XY.
Right. I know of a situation. I had a patient once whose friend was what was part of the LGBTQ community,
Mhm.
and she had some blood work done for something, and again, physically, she was identified as a female and had been identified as a female her whole life, and she's an adult now, of course. And she said it seemed she never felt right. It never felt as though that made sense to her. And so she was having some blood work done for something, and they upon looking at her blood, I found out that she was actually XY, not
Right.
XX. And
So
so
everything about her was a girl. I mean, everybody who looked,
physically,
everything, this is a girl, right?
right,
Mhm. You were
but
born a girl, you were assigned a girl, okay?
right,
But biologically, you have the chromosomes of a male.
right. So as you said, it's not it may look one way, but it may be a different way. And we don't have explanation for that. I mean,
No, we
we
don't.
have explanations from the perspective of, well, during this particular, prenatal stage of development, there was more testosterone than there was estrogen, or there may be been more of this or that at those particular times. And so it led to, the development of these things and not those things, or we can hypothesize that way, but
Right.
it's really difficult to understand and explain how some of these differences can happen. And some of these differences happen and nobody ever knows,
Right.
unless you have a blood test done, or unless you have something specific like
Mhm.
that done to you.
Right. And we're all conceived as female. We know that too.
Right.
We're all conceived as females, but then there are these hormonal changes that occur during gestation, and some of us get a Y chromosome. It's hormonally induced changes,
The physical.
and yeah, physical, and then you become a male. You're born this way, but you become this way. Well, it's not an absolute. It's not a switch that you flip and say, okay, now you're completely XY. So you are also assigned, you also become a gender based on the relative amounts of various hormones. And so the amount of estrogen versus testosterone will also have an effect on your sexual orientation or even your biological sex. Okay. And so you have a genetic influence, you have a hormonal influence. That's not even talk about this, the socio-cultural influences. But biologically, you get into this very difficult problem that should move everybody away from this binary decision that you are either this or you're this.
Right. And that's just dealing with the physical the biological aspect of it. Then you have all of the psychosocial and emotional aspects of it,
Right.
where and when I talk to parents and patients about some of this, I use examples that I hope that we can all appreciate and relate to. That when we think about gender as binary, but yet we all know people who don't fit into the perfect binary category.
Right. Mm-hmm.
We know, everybody knows some women or girls who are much more male, much more masculine acting. We call them tomboys, right? And
Right.
and they are very physical. They're very active. They exhibit all of the behavioral and emotional characteristics of boys,
Mm-hmm.
but they're girls. And we
Right.
know boys who are very feminine, who are very, even if they're not necessarily homosexual or anything, they are very much more effeminate, and they are much more on the female end of the spectrum, again, behaviorally and emotionally. And that has nothing to do, those things have nothing to do with sexual orientation. They don't necessarily have anything to do with being transgender or how they identify based upon gender. It's just, we all know them from a behavioral and emotional perspective.
Mm-hmm.
And so to say that, well, you're either male or female doesn't make sense, because we know people who cross somewhere in the middle.
Right. That's right. That intersects of
Right.
So, and here again, we have this problem. If we ignore the science, if we ignore what we know, what science has told us about sex, about gender, if we ignore the science, then on what basis do you make decisions?
Right.
If you're not going to use scientific and factual information, this is how biologically our bodies are structured. Right. If you ignore the science, then so the first question becomes, then on what do you base your decision?
Right.
And also, what do we do with the millions of, about 1.5 million US citizens are transgender? That doesn't, we're not talking about gay or homosexual or bisexual. We're talking about transgender, okay? There's 1.5 million citizens. What do we do with that?
Right.
And so what I always say is, let's go back to the Hippocratic Oath.
Right.
Whatever we do, first do no harm. Let's not hurt anybody, okay? Let's not put people in categories where they're punished. And what worries me about this legislation is that it promises to punish people, regardless of your viewpoint. It promises to punish people for making decisions that appear to be consistent with the scientific data.
Right.
And so that's, I think, where we start to get onto some very thin ice, and where we need to be very cautious. That's my personal opinion, is that, okay, everybody's entitled to their beliefs, but let's not punish one group because of their belief, because of their decision. Okay. Right.
Absolutely. But because we know that families are struggling, kids are struggling, schools are having a difficult time. Everyone, the government is having a difficult time making decisions about some of these things. So let's recognize that there's some difficulty with this, and let's, as you said, figure out how to proceed doing the least harm possible.
Right.
And typically, doing the least harm starts with not imposing one person's belief onto another,
right.
Or right. one group's beliefs onto another group. And, right. and I think that is a safe place to start. But yet, even though that's what we should be doing, as we said at the outset of this podcast, there's legislation starting that is not taking that into consideration.
Right.
And this year has been massive as it relates to that.
That's right. And the other thing to remember is that there are cultures around the world, and in fact, there were Native American cultures, and we have written evidence of this, that assigned roles to people who had this anomalous sex differences. That there were men who were obviously born and were really more female than male, and the culture allowed them to play those roles. And
Right.
these were documented in the early conquistadors wrote about this in their notebooks when they came back and talked about, and there are cultures around the world today that make accommodations for this very thing.
Right.
So 2021, and here's our alarm. 2021 has become a record-breaking year for anti-transgender laws.
Right.
33 states have introduced over 100 bills that are essentially aimed at curbing the rights of transgender people.
Yeah.
And it includes everything from 31 states have laws about participating in same-gender youth sports, and 20 states are considering legislation to ban gender-affirming healthcare for minors that will punish either parents or physicians or other healthcare providers if they provide care to these children.
Right.
The other issue for us as psychologists is this is targeting a group that is already, we know, has higher rates of suicide and depression than any other group. Suicide, as we know, we're talking about teenagers here. No one's talking about 5-year-olds and 8-year-olds. We're talking about teenagers who are beginning to struggle with their sexuality and their identity. And among teenagers, suicide is now the second leading cause of death among adolescents. 19% have seriously considered suicide. That's 1 in 5. 15% have a plan. 8% have attempted, and 2.5% have injured themselves during a suicide attempt. So the rates of ideation, plans, attempts requiring, and non-suicidal self-harm. Remember that. Let's think about all those kids who are cutting themselves and hurting themselves in other ways. It's non-suicidal, but it's still self-harm. Okay, so remember that these bills, regardless of their intention, are targeting a minority group that cannot defend themselves. They're not a voting bloc, okay? So, and they're not going to contribute to campaigns because they're teenagers. And so it's a minority, it's a very small minority that has been targeted. This issue has been targeted for punitive legislation. So here are some examples.
Well, first say, you gave those statistics about suicide risk and rates in teenagers, but that's in teenagers as a whole.
Generally.
The rates as it relates to children and teenagers in the LGBTQ community are even higher than that. They're actually, in some cases, significantly higher than that. So, as you said, we're talking about a population of individuals who can't defend themselves, who can't really stand up for themselves, but they're already vulnerable to some of these social emotional consequences and these psychological consequences of the way in which they are treated, and the ways in which they are managing different things in their lives. And so, yeah, we have to be aware up front that this is a vulnerable group from that perspective.
Right. And all we're saying is that whatever laws you decide to pass, don't do anything that will push this group closer to, we already know they're higher risk, okay? So you don't want to do anything that's going to push this group to higher rates of suicide. Imagine for a moment that a teenager is just bent on becoming transgender and then is removed from his parents and put into the foster care system, and his parents go to jail. Imagine what you're doing to that 13 or 14 or 15-year-old kid, that my decision got my parents, got me taken away from my family, and my parents are in jail or they're fined. I mean, imagine the pressure that puts on a kid. Do we really want to do that to each other? That becomes the question. I'm not for a moment questioning the intentions of people who want to pass this legislation, but the legislation should not put other people in that position. No, they don't deserve to be put in that position. They're not robbing stores. They're not hurting other people. These aren't crimes. These aren't person-to-person crimes that are being committed. Okay.
Yeah.
So let's be careful with that. We have several examples, and we don't have to walk through each of them in detail, but one of the most famous that was in the news happened in Arkansas.
Right.
It's called the Save Adolescence from Experimentation Act. And there's that language again. So language is so powerful, when you think of who's experimenting on whom. The governor vetoed this bill when it was sent to him. He vetoed it. The legislature, because he said, this bill would put government in the position of making parental decisions about many other issues, not just transgender. It opens the door to say, we're going to take parents out of the decision making, and we're going to have the state government make these decisions. And Asa Hutchinson, who's the governor in Arkansas, said, I don't think we want to go that deeply into it. And the legislature overrode his veto. Right. And this is now a law in Arkansas that we can punish parents and caretakers if they do this kind of work with teenagers.
Yeah, healthcare providers can lose their license.
That's right.
And they can face, civil litigation if they provide care to.
Right. And what is gender affirming care? Is it just physical operations? Is it chemical? Is it hormonal? Is it hormone enhancement? Is it just giving advice? That this is how you should do this. This is how you should. This is how you should dress. Or this is how you should cut your hair. So, what is gender affirming care? So we have to be very careful about these. Alabama passed a similar law, the Vulnerable Child Compassion and Protection Act. Again, what are we?
The vocabulary is very interesting.
Right. And so we have these laws, and we're going to talk about the Texas law, which kind of produced this podcast.
Yeah,
there are also educational prohibitions.
Right.
In Iowa, for example, one bill would require that parents give written consent for teachers to discuss gender identity while their children are present in the classroom.
Right.
Another stipulates that any curriculum that includes gender identity includes that it's like a warning on tobacco products.
Right.
It must also include the potential harm and adverse outcomes of social and medical gender interventions. Social gender interventions. I worry a little bit about what's social. I understand not wanting to do surgery on a 14-year-old. I get that. But what are social gender interventions?
Right. Well, and thinking back to that Arkansas situation, they even have made it a law where educators have to refer to students by their assigned gender, the gender that they were assigned at birth.
Binary. That's binary again. Okay.
Getting back to binary, and we already discussed how, what you are assigned at birth may not necessarily match with what you are genetically.
Right.
But yet that's what, and I know that you have heard about this too, Richard, but I don't know if many of our listeners have heard of these situations. We know of people, we've had patients who were, at the time of birth, there was some ambiguity as to what they should be assigned, and the parents were given the choice.
That happens. Somebody has to make a decision in the delivery room about which way we're going to go with this.
Right. And so, that has nothing to do with medicine. That has nothing to do with, really has nothing to do with biology. It's the parents in those situations make the choice. Do we want to refer to this child as male or female?
Right.
But yet again, here we have a situation where lawmakers are saying that you have to use whatever that gender was that could have been assigned by a parent, 15 years ago.
Right. Right. And again, when you say that educators must, again, you have the government saying you have to do something that flies in the face of everything we know about this very difficult problem.
Right.
And that's the problem. Is that, and again, we're not questioning anybody's motives. We're just saying you're doing something that flies in the face of everything we know about this topic.
Right. And it's different when it's a law, which It means
Exactly.
punishable by ifs in some way, versus recommendations. The American Academy of Pediatrics, the American Psychiatric Association, the American Psychological Association, those groups provide recommendations for the way in which practitioners should engage in the care of their patients. But when it's laws that are in place for this, that's a very different situation. That's a very different circumstance, because now suddenly you are at risk for being punished.
That's right.
And man, if those are heavy sentences.
Right. And that's the whole issue, is that it's one thing to issue recommendations. This is what we, based on all the information we have, this is what we recommend. This is the best way to manage this very difficult problem. But when you begin to write legislation, it carries with it punishments. If you don't, you're now breaking a law. And it's that punishment provision that I find most troublesome, because now we see, Bernie, we see parents struggling. I mean, this is a heartbreaking, difficult time in a family's life, where they struggle every day with this issue. The kids are struggling, the parents are struggling. And now to impose these punishments on this just further complicates an already complicated situation. It's an impossible thing to deal with. Now, when you add these laws to the mix, it's going to make it infinitely worse. Right? And this Texas bill is one that was in the news the other day. It was reported, and the byline was, Texas bill could send parents to prison for providing gender-affirming care. So that, of course, bylines are meant to attract your attention, so you read the article. So I read a little bit into this article. It's published last week, April 14th. And what the law does is it redefines child abuse.
Right.
And it says, administering, supplying, or consenting to provide puberty suppression drugs, hormone replacement therapy, or surgical or medical procedures to anyone under 18 for the purpose of gender, okay, that's now child abuse. Okay, it's a form of child abuse. You have to report it. It has to be reported. And if you don't, if I know that a physician has done that, I'm now going to have to report that physician. Right. You're putting us in that very antagonistic, adversarial position by writing these kinds of laws, okay? So it's punishable, it's a felony. It's punishable by 2 to 10 years in prison and having your children removed. If a parent allows this to happen, it's punishable by 2 to 10 years in prison and to have your children removed.
Right.
That to me is it is simply incomprehensible.
Right. Yeah, and it flies against everything that we know about what child abuse is.
Right.
But against what we know to be good health care. We can't, if a parent comes to us, I'm going to say, luckily, we don't live under those kinds of laws where we are. But, I couldn't imagine what dilemma I would be in if a parent came to me saying, man, my child is having these issues, and I'm wanting to, we're wanting to see what we can do to help them through this process, and to make some of these changes that they feel would help them, fully recognize and feel that they are who they feel they are. And then to have to say, well, I'm going to have to report that to the Department of Children and Families because you are seeking and in attempting to consent to some type of procedure. That would be a horrible situation to be in.
And again, I want to emphasize, remember earlier we said, we don't pretend to have the answer. We are not for a moment suggesting that you should allow your children to have these medical surgical procedures. We're not saying that at all. We're not advocating that you go out and do this. All we're saying is, do we want to put parents and medical providers in this position? Do we really want to do that to each other?
Okay. Right. And I think that while we don't know the answer, we know that this isn't the answer. That's these kinds of laws, these are not the answer. This is
Right.
not what's going to be the way to work through some of these things.
Mhm.
There are every medical organization has, well, not every, I shouldn't say every, most medical organizations have recommended procedures for us to follow when we have a patient or a family that we're working with who finds themselves in this situation.
Mhm.
Before anybody receives hormone replacement therapy or anything like that, whether it's a teenager or an adult, um, you know, it is recommended that they're working with a mental health professional, that they are working with, medical providers who are knowledgeable and um, aware of these types of issues. And so it's not like you can just go up to the store and get hormone replacement therapy. I mean, there are procedures in place to
Mhm.
help ensure that the patient is safe and that the treatment is appropriate for what's going on with the patient. That it's not just we do as much as we can to make sure that this isn't just a you know uh, adolescent angst that the person is working through and as part of that, they're trying to experiment with some of these different things. There are procedures in place to help prevent that.
Right. And it's funny. No, it's not funny. Here's the irony of this. The bill was proposed by a Republican senator. His name is Charles Perry. He's a deacon in the Baptist church. Okay, so I said, well, but he felt obligated to protect children. What he said was, who have not reached the maturity to understand what is being proposed, nor the impact on them in perpetuity. I don't disagree with that.
Right,
I think that teenagers, we have to be very careful with that teenagers don't make a decision that they can't reverse
right,
because you might change your mind. It's not that they're not able to make the decision. It's just that many teenagers are making decisions that they may not fully realize the lifelong impact of that decision. And so I don't disagree for a moment with Mr. Perry's reason for doing it. I think we all agree
right,
that, and I have always advised teenagers, do whatever you need to do superficially. Change your name, dress differently, get your hair cut, makeup, it doesn't matter. Just don't do anything that's permanent yet.
right.
This isn't a decision you have to make when you're 14 or 15. You have time.
Right. And in fact, most of those medical organizations I was referring to earlier have steps in place to do just that. So, for example, there was a patient that I was working with, and in looking up a lot of these things and trying to make sure that we were doing everything appropriate for the patient.
Mhm.
Found that the recommendation is that the patient lives, um, in essence, behaving and dressing and presenting themselves as the identified gender for up to a year
Mhm.
before any consideration is made regarding hormone treatment or anything like that. So that would mean that if someone was assigned female at birth, but they are identifying as male and they want to undergo hormone treatment, hormone replacement therapy to increase their testosterone, um, that person, to follow the procedures would basically live and present themselves as a male for up to a year
Mhm.
before there's any consideration for hormone treatment. So it's not as though somebody can wake up one morning and say, you know what, I'm going to start identifying as the opposite gender and go get hormone treatment. We're not. That's not what's going to happen, or certainly shouldn't be what happens.
We do that with other kinds of surgery, bariatric surgery, for example. It's a lengthy process, comprehensive process. You see a behavior specialist, you see a dietitian, you
Right.
see the surgeon, you have a psychological assessment done before. These are serious considerations. And certainly sex transitions are certainly fall into that category, a very serious medical decision, and it should be given time to make sure that this is the decision that you really want to make. And these are decisions that the typical 13, 14, 15-year-old needs as much guidance as possible. Certainly doesn't need the threat of punishment. They need as much guidance. I would say, Mr. Perry, let's talk about this. We don't disagree about permanent changes, but let's figure out a way to do this that doesn't punish, that doesn't target a group and punish that group or parents or care providers.
Right. Absolutely.
There's a better way to do it.
Absolutely. Yeah. Nothing. I mean, we don't want our 13 and 14-year-olds getting tattoos.
Yeah.
You know, and that's, you know, superficial, literally. But so we wouldn't want to jump to those, anything else that's permanent, without following a procedure and making sure that that is the right thing to do.
Right. And certainly in this day and age, you know, there's so much animosity, there's so much anger among us with what happened last year with the election and the Black Lives Matter movement and the pandemic. Those large events really turned us against each other. I mean, there are families that literally are not speaking to each other because of the election, because of Black Lives Matter, because of the pandemic. So we have these issues dividing us. And, you know, do we really want to turn against each other, whether it's a large group or a small group, especially when we understand so little about this very complex issue? We're just beginning to understand the science, the biology behind gender determination. And until we know more, let's not target these groups and punish them, you know, write these laws that could punish them. You know, in my lifetime, there was a time when people of different races were not allowed by law to marry.
Right.
They had to marry, they had to secretly live together because it was thought, I don't know, unnatural or wrong or something. Then that was in my lifetime. We saw the same thing. Look at same-sex marriage. You know how that issue that was supposed to be unnatural. It's between a man and a woman. Again, binary. Look, it's a binary decision when maybe it's not so binary. And so there are other things we can point to say to argue for caution. Let's be cautious. Let's be judicious. Let's be careful. Let's not just start by punishing people and making things illegal. Okay. Right. Let's not politicize what is a deeply personal family dilemma. Okay. This whole issue of transgender, especially in teens, is a very complicated issue. There's no clear answer. And parents are walking this fine line between alienating their children, losing their children, not affirming their children, right, and at the same time not giving into demands for permanent changes. Okay, so parents are caught in this very delicate razor's edge where they want to affirm their children without giving in too much on the issue. And the second issue is we frequently hear lawmakers say that schools or other government agencies shouldn't be allowed to do certain things that are really the parents' right, like sex education. You know, schools shouldn't be doing that's a parent's right. Schools shouldn't be talking about this, that's a parent's right. Schools shouldn't be doing, that's a parent's right. Suddenly with this issue, we're saying, no, parents don't get to decide, the government gets to decide. Well, you can't have it both ways. I mean, if the government shouldn't be involved in parental decisions, then the government shouldn't be involved in parental decisions. Let's be very careful about saying it's okay for government to be involved with this group, but not with this group. I think that puts us in a position I'm not sure any of us want to be in, okay? So what's our advice? I think, okay, so where do we go? Yeah. If you're a parent, first of all, if you're a legislator, please be careful and please don't write legislation that harms anybody, okay? Right. None of these people, not the kids, not the parents, not the care providers, not the teachers who have to be careful about their language, none of these people deserve to be punished. Right. Nothing is happening here that should be punishable by fines or imprisonment.
No one's being malicious. I mean,
no.
what
There's
it,
no intent here.
what
Right.
is anybody doing that's harming anyone?
And the decision they make is affecting their family.
Right.
And it's a decision that that family had, however they decide to deal with it, it's it's a family problem that they're going to have to deal with.
Right. Yeah.
Mhm.
Yeah.
Right.
It doesn't have it's not affecting anyone else outside of the family.
Right.
So yeah.
Yeah, so we ask you, don't target this group, this minority. They're not an enemy. Okay? And that's the other thing. LGBT, the LGBT community is not going to destroy our civilization.
Right.
They are not after control. They're not a threat to anybody. Okay.
Right.
They are struggling with their issues like I'm struggling with my issues. Okay. Their issues are different, not better, not worse. They have their own private struggles. They're not going to take over anything. Okay. That's number one. If you're a parent of a youngster who is struggling with this issue,
Right.
now there's nothing more dear to us than our children. Okay. So whatever our children's struggles are, we're in 100%. Okay. You're not going to love your children less for any reason, no matter what decision they make. They may get involved with drugs or alcohol or sex or whatever. You're not going to love them less. You're going to worry more, but you're not going to love them any less for this decision. And your love isn't unconditional. It is unconditional. It's not going to, well, I'm going to love you if you get a D1 scholarship. I'll love you more than if you don't get a scholarship. No, it doesn't work that way. I might be proud, but that has nothing to do with how much I love you. Okay, so our love should be unconditional. And if your child is struggling with this issue, they still need you and your support because it's a very difficult struggle. You have to affirm and respect your child. If I have not personally had to deal with this issue, so all I can do is try to be understanding of parents who are struggling with it. Okay, because I know it's a struggle. I see the parents in tears. I see the parents struggling to make the right decision. I see the parents saying, I want to affirm and respect my child's opinion, but I'm struggling to do so because it's not what I want for her or for him. Okay.
Right.
And I understand that. Parents know how difficult it is for the LGBTQ community. Those people are facing a lot of obstacles.
And I think that that's the big thing is that, for a lot of parents, their resistance to it or their pushback to it is because they know what difficulties lie in wait for kids who are in adults, even who are, dealing with those issues and living that life. So thinking about, so what kind of advice to give the kids? Be aware of that. Be aware that there's going to be some resistance, not necessarily because people are resisting you, but sometimes it's just resistance because they don't want you to have the kind of struggles that you're bound to or likely to experience. Sometimes the resistance is based upon bigotry. Sometimes the resistance is based upon disinformation or misinformation or whatever. And sometimes they're based upon beliefs. So that resistance can be, just a pushback, and sometimes it could be worse. It could be,
Right.
We hate hearing about, violence against this group of individuals, but it could happen. And so it's just important that kids are aware of that. And because of that, resist that urge. In adolescence, we're already a little bit more impulsive and less patient than at other times in our life. And so, resist that urge to do anything that's permanent, anything that's going to be so long lasting that you can't undo it. Just be mindful of those kinds of things, because this is a big decision. And it's, even using that word decision, I understand is controversial because it's not a decision. People recognize this as who they are, not a decision that they're making about who they are. The decision is more related to the decision to how you're going to proceed with it. You know,
I want you to, I think we should emphasize that point. I think it's an absolutely, the word decision is absolutely critical here. You're absolutely right. You don't decide. Parents will come to us and they will say, well, she's not old enough to make that decision. Okay. That's how this begins. Or she's not ready to make that decision. And the first words out of our mouth is, she's not deciding, biology decided. Okay. Again, it's not binary. It's not like she was only this and now she's made some decision to be this. No, that decision is made for them. Nobody would decide to take on the challenges. I mean, think about it, the life that you're facing. Okay. So the decision about your, and I don't know what word to use here, gender identity, it's not gender orientation. It's more how you define yourself.
right,
Is made for you. Okay. Where the decision becomes important is, what do you want to do about that?
right. Is how you're
And at what age?
right.
Say that again?
How you're going to manifest it.
That's
Yeah.
right.
Yeah.
That's right. And because Berney and I spent a lot of time working with middle school children, writing about it, talking about it. Middle school is the most confusing time of adolescence, from puberty to about the end of 8th grade. The end of 8th grade is about 14 or so, 13, 14, 15, is the end of middle school. Grades 6, 7, and 8 are the most tumultuous, confusing time for teenagers. After that, after they get to high school, you'll notice that kids become more stable as they get older, okay? And because the brain matures. And when you're an older adolescent, you're just much more stable. I mean, look at your 18-year-old compared to your 13-year-old. Who's more stable? The 18-year-old, okay? So it's very important that we not let these young teenagers make too many decisions, because their life is in turmoil anyway because of the rapid changes in their brains. As they get older, you can talk about other things that you might do. So the decisions you make is the important consideration. The decision as to who they are has already been made.
Right.
I mean, we have, Bernie, I'm sure you've had this. We have many teenagers who come in and say, I knew this when I was 5 or 6 years old. I knew this since I was 7.
Yeah.
This hasn't changed. I didn't make this decision when I was 15. I felt this way when I was 8.
Yeah.
You know? And they'll tell us that. It's very candid. They disclose, I've always been this way. You know, it didn't just suddenly happen. Or I suddenly realized when I was 14 what all this confusion was about when I was 8, 9, 10, and 11.
Yeah. Absolutely.
Okay. So the decision is made, that decision is made for you. You now have, you and your parents now have all these other decisions to make, which must be made very carefully so that you avoid some of the important challenges that you are going to face. And depending on where you live, you could face more than just verbal criticism and name calling. You know, you could be putting yourself at risk physically.
Right. Yeah.
From bullies and other people who are opposed to this.
Well, and again, I think bringing it back to the purpose of this podcast is that, you know, and now in some states that consequence is legal, and can have legal consequences.
Right. That's right.
You know, fines and even prison, or the removal of your children. So you know, the decision is what we're going to do about it or how we're going to process through it, not what it is.
Right.
And
so now, and you're right, we're adding this additional burden. You know, not only do you have to worry about bullies and thugs and people who are opposed to you, whether, you know, you can be kicked out of your church. Right. You can be kicked out of sports teams, schools, if you use the wrong restroom. There are lots of personal, social implications. Now, with this 100 laws being debated right now you're also going to have a legal consideration to add to this equation. So it's further complicated by these recent laws that are being passed. And that's where I take issue with the legislators, because these are adults who should be helping, not further constraining these kids and their families.
Absolutely. So we had the link to some of the articles in the show notes. So we encourage you to read some more about it. And even go to, the American Academy of Pediatrics and the American Psychological Association, American Psychiatric Association, and look at what they recommend and suggest about some of these things. And you'll see that, no one is encouraging or recommending any type of impulsive decisions, especially as it relates to youth, youth patients, adolescent patients. So, educate, learn more about it. And, if you or your kid or anyone that is going through this, encourage them to seek the support of mental health professionals, medical professionals who are aware of these types of concerns and issues and can help process through it and help you walk through this tough transition.
Yeah, I think we have to, it brings to mind this whole controversy over conversion therapy, where, we struggle with that and said, well, we can change them. We can somehow change their mind. It wasn't that kind of a decision they made. Okay. You weren't, and now we know even the founder of conversion therapy has recanted and said I was wrong, And so these are complex issues. They're going to require complex solutions, and they're going to require all of us working together. And we plead with legislators to proceed cautiously on this issue, because you don't want to add punishments, either fines or imprisonment, to an already complex issue. It just makes it even more complicated for everybody.
Absolutely. So
they're not a threat. This is not a threatening minority who's going to overturn the government. These are kids and families that need our help and support.
Absolutely. All right. Well, that is it for today. Until next time, stay happy, stay healthy, and forget to be afraid.